The UK COVID-19 inquiry, a deep dive into the Dyson ventilator controversy. The ongoing UK COVID-19 inquiry has delved into a controversial episode involving James Dyson, his company's ventilator proposal, and alleged pressure exerted on the Medicines and Healthcare Products Regulatory Agency, MHRA. At the heart of the matter is Michael Gove, then Chancellor of the Duchy of Lancaster, CDL, and accusations that he attempted to expedite the approval process, potentially bypassing crucial safety regulations. The inquiry heard damning evidence suggesting that Gove's office sought to circumvent the MHRA's established regulatory pathway. An email from Graham Tunbridge, the MHRA's Director of Devices, painted a stark picture. CDL was keen to press forward with Dyson's proposal to a timescale that is totally unrealistic, based in part on promises made by Dyson that are already not being fulfilled. In addition, however, CDL did not appreciate the level of risk involved in the manufacture and use of ventilators and wanted to circumvent the expedited regulatory process that has been put in place. This email lays bare the alleged attempt to prioritize speed over rigorous safety checks, a deeply concerning allegation given the life-or-death stakes involved in providing medical equipment during a pandemic. The pressure to meet an arbitrary deadline, as described by the email, raises serious questions about the decision-making processes within government during a time of national crisis. Gove vehemently denied these accusations, characterizing the suggestion that he sought to pressure the MHRA as ludicrous. He painted a vivid picture, arguing that it would be inconceivable for any minister, himself, Matt Hancock, or even Boris Johnson, to deliberately introduce potentially lethal medical equipment into hospitals simply to meet a deadline. He emphasized that Dyson's prototype ultimately did not get through testing, and that he consistently prioritized safety considerations. However, the inquiry presented compelling evidence contradicting Gove's assertions. An email from Gove's private office issued a clear directive. MHRA and GRW Gareth Rhys-Williams, then the chief commercial officer at the Cabinet Office, to ensure that by the end of Friday, the Dyson product has been tested and approved by MHRA. A small number of products have been provided to hospitals for human testing, and the final product has started to be manufactured. GRW to escalate any blockages to ministers. This email, far from being mere aspirational language as Gove suggested, reads as a direct instruction to expedite the approval process, raising serious questions about the level of influence exerted by Gove's office on the independent regulatory body. Gove's explanation, that it was merely shorthand for a hope that the product would be approved if testing was successful, seems inadequate given the assertive tone and specific timelines outlined in the email. Further evidence emerged from John Manzoni, a senior Cabinet Office civil servant. He expressed concern that indirect pressure was being placed on the MHRA to approve the supplier's design, following a meeting with Gove, Dyson, and Rhys-Williams. Manzoni's intervention underscores the perceived pressure felt even by high-ranking officials within the government. He felt compelled to intervene, to ensure that the MHRA approval system, as the regulatory system, was properly applied and to protect the integrity of the process. The inquiry also revealed that Rhys-Williams, in a separate email to Manzoni, felt Gove was being unreasonable, expressing concern about the pressure being placed on the MHRA and noting that the Dyson sample was not yet ready for testing. This internal disagreement highlights a potential clash between political pressure and the imperative for rigorous regulatory oversight. The question remains: did the pressure compromise the MHRA's independence and potentially jeopardize patient safety? Gove's claim that his involvement with Dyson's proposal didn't detract from resources allocated to other bids is also being scrutinized. The inquiry's focus extends beyond Gove's actions, exploring the broader context of government decision-making during a national emergency. Lord Agnew, a Tory Treasury Minister, had previously warned a senior official about procuring ventilators from Dyson to facilitate international marketing, suggesting the potential for undue influence and commercial interests intertwined with the urgent need for medical equipment. Dyson's spokesperson offered a defense, stating that the company responded to a direct request from the Prime Minister to develop and manufacture ventilators within 30 days. They emphasized that Dyson had no intention of profiting and incurred significant commercial costs, diverting 450 engineers from other projects. Ultimately, the order was canceled due to changes in treatment strategies, highlighting the rapidly evolving nature of the pandemic and the uncertainty surrounding the need for mass ventilator deployment. The inquiry's proceedings thus far highlight a complex interplay of political pressure, regulatory oversight, and the immense challenges faced in managing a national emergency. The questions raised regarding potential attempts to circumvent the regulatory process, prioritize speed over safety, and the potential for conflicts of interest underscore the need for a thorough investigation. The full picture is yet to emerge, but the inquiry's findings will have significant implications for understanding the government's response to the pandemic and the safeguards in place to protect the public. The inquiry continues, and the full extent of the alleged pressure and its impact remains to be seen. The ongoing testimony and evidence promise to shed further light on this critical aspect of the UK's response to the COVID-19 crisis. The ultimate goal is to ascertain whether appropriate procedures were followed, whether patient safety was ever compromised, and what lessons can be learned to prevent similar situations in the future. The legacy of these events will undoubtedly shape future responses to public health emergencies, demanding greater transparency and accountability in government decision-making.